So it's 4:30. I'd like to get started. I'm going to try this experiment. So this is our first Zoom call as we resume our town halls, and I'm so grateful, and that I think at this point we have 103 people on our Zoom call. And when the pandemic first hit, we started weekly phone calls, and really just to stay connected to, I could stay connected to all of you and the executive team. And when things settled down, we stopped the town halls because there just wasn't a lot to talk about. And things are changing again. And I'm going to recognize Danielle Wilcox, who is on the line, who in her huddles, one of her huddles, she gave me feedback that her staff said that they missed the town halls. So given how quickly things are changing and how many new things there are for us to talk about, we thought now would be the time for us to restart our town halls. And now that we have this Zoom technology and we use it for all of our meetings, I thought it'd be a great way to try having this town hall. I'm not going to mute all, so we'll see if everybody can, if this will work. If it gets too noisy, I will mute all. But I do have some folks who are going to participate in the conversation today. So welcome. I'm so excited to have you all back here and really talk about the current state of affairs and the current state of COVID in our region. When the pandemic first hit, do you all remember how long we waited weeks saying we were waiting for that first patient to come, and we didn't exactly know what to expect, and we waited, and our numbers we always had pretty reasonable numbers. And now we have the highest numbers in our region that we've had since the pandemic has begun. The numbers today, we have 42. Amanda will probably correct me, or Pam, but as of the last report, we had 33 COVID positive patients at Bacchus and 9 positive COVID patients at Wyndham. And we had 9 PUIs here at Bacchus. And it changes by the hour, and every day it looks different. But what's different now is we know how to manage COVID patients. In the beginning, we were fearful, would we have enough PPE? We'll talk about PPE today, but we know we have plenty of PPE. So I want to talk a little bit today about how we're preparing for the surge. So that's one topic today. A second topic is around the great news around the vaccine, right? It's in the news. We'll be getting the vaccine. We'll be starting our program, our vaccination program. But there's a lot we still don't know. So I wanted to start off with some guiding principles, which you all know. We work very hard to bring the latest communication and information to all of you. I also know how tired all of you are. I want to begin by recognizing all of you for the incredible work you've done since March. We have been cared for whatever patients came our way. We moved patients around the organization, and we provided really, really good care to our patients. I thought it would be helpful for all of you to know that over the course of the pandemic, at Wyndham, we transitioned 104 patients and had 9 deaths. And at Bacchus, we discharged or transitioned 188 patients, and we had 32 deaths. So just putting some scope and some context to the experience we've had here in the region, I think is really important. And many of you ask questions about the latest pathways and treatments, and we're very, very fortunate as part of the system to have system guidance and leadership through supply chain, and I see Milrose and Sharon here with us today. Dr. Kumar and his teams right now, Matt Kaufman and Laura Curry and Bob Sidman, are actually on a system call with Dr. Ajay Kumar and other system clinical leaders talking through our plan for vaccinations. So again, we'll talk more about that. Um, so that is the context with which we'll begin today's discussion. But a couple of guiding principles. Nothing's been perfect. We've had fits and starts, and I think what's most important for all of you to know is we take every concern seriously. We had a conversation earlier on our emergency operations call that, way back in the beginning, we worried about N95s and all kinds of PPE. And Milrose, you reported out today about gloves. And I thought what you said was so important about the production. If we could take a minute or two and just explain to, our team of now 156 people, the situation with gloves, and really giving your perspective on the quality of our gloves and what we're doing to assure that staff are getting the right gloves that will protect them.
Absolutely, and thank you, Donna, for inviting Sharon and I to this discussion. So I'll start by just prefacing a little bit of what's going on from a market perspective. So I think health systems across the U.S. continue to be challenged with reliable supply lines, and that's everything ranging from gloves, from masks, from gowns. The increased global demand has really led to just persistent shortages and back orders and distributor allocations across the board. And I would say that gloves right now are probably what we consider N95, so very difficult to source. So at Hartford Healthcare, in order for us to really support our growing demand, we're sourcing from multiple channels, and that is traditional distribution, our group purchasing, as well as international sourcing. But as we've done this, we've seen really an increase in product defects from all the channels, right? So as it relates to gloves, we're seeing some discoloration, some odor, sometimes it's thicker or thinner material, even though our defect rate is really less than 0.6%. So, I think that part of this is because manufacturers are really struggling right now. This increased global demand has really put pressure on their ability to produce. And that increased demand has actually led to more quality issues. And this is an industry-wide issue, not just at HHC. So one of the things that we've established with infection prevention is we have a really well-defined process to make sure that we're minimizing risk, that we're calling out, we're making sure that the products that we're bringing in meet our appropriate quality standards. And so, from a market perspective, unfortunately, it's the environment that we're managing in, right? Mm-hmm. That there is an expectation that there could be some defects, but what we're asking for is that if there are, please let supply chain know, bring us into the discussion. We're going to do the due diligence with infection prevention and really come out with recommendations for the group. But again, I think the important piece here is we know that there's some market challenges, but continuously bringing those things to our attention is critical.
Thank you, Milrose. And I think that's exactly the message we wanted to send. Please arc it up and let us know. We will immediately respond to your concern, evaluate it. And multiple times in the East region, we've had our share of taking product off the shelves and replacing it. So we really, appreciate that advocacy. As we've evaluated this next surge, and we anticipate, the modeling tells us that we'll have a peak surge in January, likely between the first and second week of January. Now, it's a different kind of surge than we had back in March and April. The patient population is different. We have, widespread community transmission of COVID. So we are working very diligently, our team, on a plan to care for our COVID surge, to continue normal operations. It is critically important that we continue to do surgeries, perform cath lab procedures, imaging procedures, so that we keep not only our communities healthy, but that we continue to have operations within our health system and within our hospitals. So we have stuff, we have ventilators, and we have equipment, and we have PPE, and we have space. We have a really strong plan in the region as numbers rise, how we will move things around to care for patients. Probably the third resource, and from my perspective, the most important resource, is staff. As you all know, if you look left and look right, you know somebody who's either been COVID positive or is COVID positive. And it's really a big issue for us. we've had, with drive-through testing sites. We have grown our testing sites at Dodd Stadium 7 days a week, 8 hours a day. Wyndham, we've expanded from 4 hours to 8 hours a day, Monday through Friday. We're moving that test site to Recreation Park next week. And then the following week, we're going to 7 days a week for testing. As the incidence of COVID in the community rises, and in Norwich, it's, I just want to look at my numbers. We have 9% and 6% community positivity rates in our two communities. It is out there. It is honestly, our staff are contracting COVID in the community. We continue to do aggressive contact tracing whenever a staff member is identified as positive. Amanda and I were talking about this earlier. Amanda, unmute please, that, it is our policy that if you're COVID positive, that you call the CCC and we let occupational health know, so we can do that contact tracing to keep all of our staff safe and all of our patients safe. It is critical, and wearing masks, socially distancing, and good hand washing are really incredibly strong hygiene procedures that really will flatten the curve. And when you go out in the community, using those very same guidelines to protect yourself and protect your family is so important. We've been challenged, honestly, because our testing, the volume of tests has been so huge. Quest got so backlogged, we found alternate ways in which to test. And we're soon, I think it's this week, Sue or Amber, you can certainly let me know, where we're within 24 hours, our goal is to have surveillance testing for employees and colleagues within 24 hours. Because we need everybody at work, not home waiting for their test results. And that's really been a challenge for us and for all of you over these last several weeks. Our call-out rate is very high, less so at Wyndham. Backus call-out rate is much higher, so staffing is an issue. So our main focus and goal is keeping our staff safe and protected so that, you're all working with your full staff caring for patients. But a question that is every day, I'm sure you get asked these questions as I do, and Amanda's agreed to talk through what the process is if you've been exposed, think you've been exposed, what your exposure has been, and what you need to do. And we'll be sending this out in a one-pager later tonight or tomorrow so that you have very clear guidelines. Everything is on our website, but it's not so easy to find everything. So we want to simplify this and just walk you through that. So Amanda, would you please?
Yep. So a couple of scenarios that we get quite a bit. First one, what if I live with someone that's been exposed or has been notified that they have been exposed to someone? So for example, if you have a school-aged child, you get a phone call from the school saying your child may have been exposed to somebody. So for you personally, that's considered a secondary exposure. So you would just continue to monitor for symptoms. You don't need to call employee health. However, if the child or spouse or whoever you live with does become positive, at that point, it's considered a primary exposure and you would want to call employee health. So that's the first one, which kind of ties into the second one is, what if I live with somebody who's COVID positive? So that's considered an exposure, and you would need to call employee health, and they would walk you through what your next steps are. Everything is taken on a case-by-case basis based upon your level of exposure, your ability to quarantine at home, that kind of thing. So you have to call employee health if you have somebody that you've been in contact with that's positive, and then they will give you the guidance. And then what if a colleague I work with is positive, and we've been getting that one a lot recently. And like Donna said, it's so important, if you get a positive result, please call employee health. For HIPAA reasons, we cannot go into employees' charts. We will not know if you're positive unless you call employee health. So call employee health. The thing that Cindy Edwards, who's our employee health nurse, does is she does a contact tracing with all of our employees. So she'll talk to them and ask them if they've been anywhere at work without a mask around other colleagues. Did you eat in the break room with anyone? Were you within 6 feet, and did you not have your mask on? Anybody else, that you've been around, did you take your mask off at the nurse's station, that kind of thing. And that's how she does her contact tracing. Again, it's HIPAA. We cannot tell you, like for me, someone can't say Amanda Lester tested positive unless I give them permission. If I was around somebody and I didn't have my mask on and I gave Cindy permission to tell that person, then we can tell them. So that's when you would be notified. So we don't notify every department every time if there's been a positive, only if there's been an exposure. And then, let's see, what if on surveillance of a patient that was not identified as a PUI, the patient comes back positive? So for example, a patient that we did not have on isolation and did not go to Stay North or A3, our COVID units, we did the routine surveillance and it came back positive. What do we do? So we do contact tracing for every one of those. So it's myself and Pam Harrison, who's the IP at Wyndham and in our outpatient areas. We look at all of our new positives and we look to see if they've been on isolation the entire time. If not, we start the contact tracing process and we work with employee health on that. What we do is we go through the chart and determine the exposure period for that patient. So it's 2 days prior to onset of symptoms. If they're asymptomatic, you go back 2 days with their test. And we go through the chart and we see which departments may have been affected. And then Cindy works with your managers in order to notify you and screen you. If you were wearing the right PPE, which I hope we all are because it's part of our universal PPE, it would be considered a non-exposure. So that's why it's so important for that eye protection for all patient encounters, and then procedure mask for regular routine patient visits, and then the N95 that you would wear for AGPs. So that's the contact tracing part. And then if the patient had a roommate, we also have a process for that. So we have the provider notify the patient, and the patient's notified they need to quarantine for 14 days. There are signs and symptoms to look out for, that kind of thing. We put them on strict isolation and they're tested initially and at day 5. And then they would stay on isolation for us for the full 14 days or be informed to quarantine at home if the 14 days is up. And then finally, and this one's been coming up a lot lately, what to do with a patient that has a history of being COVID positive, so a readmission. And I think the reason this is popping up so much lately is we did have that initial surge of patients back in September, October. So we are seeing some of those come back in for other things. They have a history of COPD or CHF, something that they need a hospitalization for. So there is a criteria that's up on the toolkit, and we can send it out if everybody would like it. But it really depends on when their positive was. So all patients will require isolation for at least 10 days. And then after that, between 10 and 21 days, we look at whether or not they can come off precautions. After 20 days and within 3 months, COVID patients will not need precautions. There is no literature that shows that anybody can be contagious that long. I think the longest they've seen is 18 days. And people can actually test positive for up to 12 weeks. The positive result doesn't indicate infectivity. It just indicates that they have pieces of COVID virus in their nose that we've swabbed. So people that are being readmitted within that 3 months, also they don't need to be re-swabbed. So you will occasionally see patients that don't have a surveillance swab done, and that would be why, because they've had a previous history of COVID. And then that clock resets after 3 months. So after 3 months, again, they get looked at with our standard PUI criteria and placed appropriately. Did I cover it all?
So you can see it is a lot, which is why we're going to send you a one-pager. And I think it's really important to know that we test every patient except for those that have that have been positive. And patients who we call it a surveillance test. Sometimes they do come back positive, and we immediately have standard policies and guidelines that we put in place. Many of you have had, I've talked to staff who said that they're anxious about, being positive and go for testing once a week or twice a week. Starting today, you have to print out your health stream consent form and present that when you go for testing in order to get tested. So we had a new COVID alert come out today. Danielle, I sent off your note to Mr. Flax with the feedback from your huddle. And that's the beauty of our organization and the feedback from you, from all of you. And with the many changes, we're sending out those COVID alerts more frequently. So remember, and it's in the daily huddle message, so if you just make sure that everybody knows to print that so that they're not frustrated and have to go back a second time. But really, so we continue to deal with the changes related to COVID, but the exciting news is about the vaccine. We're still waiting technically for it to be approved. The first patients in England, I don't know if you watched the early morning news before you came to work this morning, but I saw the first woman in England getting her COVID vaccine this morning on international news. And I'm asking many of you, all of you, to do the survey, complete the survey that came out in a Hartford Healthcare communication. As of today, about 7,700 colleagues across the system have answered the survey. And it's really, will you, when we have the vaccine, will you take the vaccine? And at this point, out of 7,700 respondents, about 45% of staff and providers have said that they would take the vaccine. So we expect by the end of the week that the first doses of vaccine will come to our system. We are still, so much of this is still in the process of being built, and we honestly don't have as much information as we'd like to have. We originally thought that the first shipment of vaccine would be about 9,000. We now know that for next week we'll have 1,950 vaccines. And as you know, it's a two, whether it's the Pfizer vaccine or the Moderna vaccine, it involves 2 injections. It's for Pfizer, it's a injection and then a second vaccine 21 days later. And for Moderna, it's 28 days after the first injection. So we'll be communicating with you the process. Initially, we are prioritizing the staff that are at highest risk. That's really what's happening on the call right now with our clinical leadership. And it's about who should get the vaccine first. There will be, over the course of weeks, we anticipate by week 3 that we'll be getting many more doses of vaccine on a weekly basis. We'll be communicating clearly with you, but our team, Becky Durham, Matt Kaufman, the pharmacy, the whole team is working on the process by which we'll identify staff, prioritize them, and then we'll communicate that with you. We encourage all of you to consider getting the vaccine. This combination of the vaccine, the fact that we have new drugs to treat COVID-19 patients, and our mortality rate is actually decreasing, gives us great hope that over really the course of the winter into spring that we'll be in a much better situation. We do anticipate that based on the Thanksgiving holiday, we expect about now that we'll start to see a potential increase in numbers. So we're watching for that, anticipating that for that, and planning for that. And then we'll have Christmas. So there's a lot of variables. So we have to be able to react to whatever, the current conditions are in the organization. So more to come on the vaccine. We will be providing the vaccines for the healthcare community. So we do not have those plans completely in place, but home care, our ambulatory settings, the federally qualified health centers, and other private practices. As you think about what we think as we define our community of healthcare workers, that's a really large group of people. We're anticipating it's about 36,000 people that would be eligible and that we would vaccinate if they so decided. So much more to come. Our first doses here on the Bacchus campus will be Wednesday, and it's on Thursday at Wyndham. So we'll be sending information out communicating with you. So it is going to be very important for you to read our communications, and we'll be very consistent in making sure that there are huddle messages written. Emily's terrific at that, so it will be on your huddle board. So more to come on the vaccine. I would encourage all of you to, if you don't do that routinely, we still have many, many resources available to all of you. We have colleague support. We have our clinical, the CCC for COVID questions. And on the front page of our intranet, you have all of those phone numbers. I did want to leave a few minutes for questions. Now, you can go to your screen and type a question, or I'd be willing to try if somebody wanted to ask a question. I don't see anybody typing.
They can raise their hand.
Yeah, you could raise your hand too. There's a little button that says raise your hand. And that would, no? Well, I'd be very interested in your feedback. From Katie Pollard. From Katie Pollard to me. Just wanted to also stress the importance of physical distancing when in common areas and break room. So I think that's a more specific definition about social distancing. I know that when you take your mask down to eat, if you're in close proximity, you increase the risk of transmitting, the virus. So thank you for that reminder, Katie.
Donna, this is Annette. I have a question from my staff.
Thank you.
Yeah, they were wondering just around with getting the vaccine and the, at this time, reported side effects. If they call out of work sick, will those be considered from the side effects, or don't pass their safe pass? Will those be considered excused absences, or is there any planning going on with that?
Thank you, Annette. That's a great question. So the answer, a couple things about the vaccine. At this point, we're not making it mandatory. There's some conversation about giving everybody, just like we wear a flu tag, signifying that you've had the COVID vaccination. What we know to be true from the early data, the Pfizer vaccine, on the first injection, about 2% of people complain of some myalgia and mild GI symptoms. Very little, but some fever. With the second injection of the Pfizer vaccine, that does go up to 50%. Now, we're talking through who needs to stay home, who can come to work. Fever, obviously, you're out of work. Mild GI symptoms, myalgias, muscle pain, joint pain, if you feel comfortable and able to work, our anticipation is that you would be allowed to work. We are having those very discussions now, Annette, so I think you're ahead of the curve as always. So we'll communicate that as the teams and make those decisions. What we were hoping, honestly, is we could time the vaccination, people that choose to get vaccinated. If they could have it on a Friday, if they were off the weekend, up 4 days off, so that if they should have some mild side effects, that you could stay home without the risk of PTO time. So more to come. We're getting chats. I love this, you guys. Let me just look at this. Dr. Bay. So when can we expect the vaccine for healthcare professionals? It's going to be totally related to the volume of vaccine that we get. That planning is underway. We anticipate, the initial guidance is emergency department, critical care, PACU and anesthesia, and our COVID positive units. But we will be, over the course of what we anticipate is 7 weeks, have vaccinations for all of our healthcare professionals that want it. Oh yes, another reminder, the patients need to wear their masks when somebody enters their room. If they're alone, they can leave their mask off. But we should all feel very comfortable reminding patients to put their mask on. Okay, so question, the main entrance seems to be full of waiting patients to be tested for COVID. Are we planning to open another entrance at Bacchus again? You know, it's really interesting. I had that concern too, but we have, and maybe we need to do a better job of spreading folks out. We have the social distancing pads on the floor. We have chairs lined up all the way down the hallway to the library to allow that. So I'll have to reevaluate that process. We do not have plans at this point to do a second site. That's, from 1:30 to 4:30 at Bacchus, both pre-procedure patients and colleagues can get surveillance testing there. So it's typically much more crowded from 1:30 to 3 or 3:30. At the end of the 4-hour period or the 3-hour period, it seems to be less, but we'll take a look at that, Jason. Okay, this is a great question. Can I clarify, is it occupational health or employee health that we need to contact for employee positive results? We use the term synonymously. OC health is employee health. OC health is kind of the new name for employee health. But you can call it the CCC or Cindy Edwards. Will vaccinations be staggered? Brian, yes. Because the chance of side effects, the rolling guideline, once we have lots of vaccine, is that only 10% of any department or unit would get vaccinated at the same time. As we look at the high-risk areas around ED and critical care, we are going to stagger them. And Becky Durham and Tori Tyler have taken the lead for us, really looking at how we would stagger our departments, even starting with our high-risk departments, and how we would, stagger them. There's so many variables. If at this point only 45% of people are going to get the vaccine, so it's going to be really important that we roll out a process that we can understand who wants the vaccine so that we can begin to schedule them. So Jessica Seal, any suggestions for reliable information regarding the vaccine for people with concerns on taking it? I think there are a couple, Jessica. The COVID alert today begins talking about the FAQs. The CDC, we're following CDC guidelines. CDC is always a resource. But also our CCC is a third source of reliable information regarding the vaccine. And I would offer, Amanda, our health and infection prevention teams. But I think what we could do, given that question, is we could put that in our communication and messaging, where to go for more information and resources. Lots of folks like to do their own research. So will both vaccinations be from the same manufacturer? Yes. So if you get a Pfizer vaccine for the first dose, you will have Pfizer for the second vaccine, and the same with Moderna. Their profiles are a little bit different. With Moderna, more people in the first injection have side effects. We're by week 2, we anticipate, and we don't know, but we think we're going to have both Pfizer and Moderna. So you can see how rigorous and disciplined we have to be, not only in documenting the vaccine that you get, scheduling the second vaccine in order to really maximize the effect of the vaccine. So that's why it's taking, we have a whole bunch of people that are really working on this. Let's see. So Carly, all regions will be getting vaccines and beginning to vaccinate at the same time. We got the calendar of when we're going to run the COVID vaccines just like we ran the flu vaccines. You'll register for an appointment. We have to figure out how we identify those groups that are going first. So you'll get a kind of a release that you're up to be able to register for the vaccine. But all 5 regions are getting we're starting at all 5 regions next week. We'll be using the data it's a very interesting question. Will we be using the data from those of us in the antibody study when the vaccines roll out? So I don't know. That's a great question. Eric Alia offered to be on this call, but I don't see him. We'll get that question, Kevin, and we'll put it in our own FAQs. These were great questions. I love the person who thanked us for holding this. We're going to do this every week. So what I would love, whether you send it directly to Donna Handley email or Handley 3, I'd love you to send topics. That's really worked really well when we were doing town halls initially. I really want to be talking about and bringing experts to talk about the things that interest you most. I can assure you that weekly we will have a segment on vaccines and really any other changes that are happening. I really like to keep all of you informed as to the state of the region in terms of positivity rate and other things, but please do let us know what else you would like to hear about. By next week, we'll be having our first vaccine clinic here on the Bacchus campus. I have to look, I think it's Thursday or Friday at Wyndham. So there'll be much more detailed information by next week. We originally started having them at 6 p.m. so that more people could attend, but tonight we've got MedExec at Wyndham, and I need to be on that. So, I'd love to hear from all of you if you think this is a good time of day to hold these town halls. We've gone a little bit over, but not by much, just a few minutes. Oh, I have one more here. It's more about the colleagues and pre-op patients getting tested. So here's what's really interesting. We made, and I should have talked about this, colleagues can get tested at the drive-thrus the first 2 hours just as pre-procedures. And I had a staff member tell me that they went over the weekend to the Dodd Stadium drive-up and they got expedited through because in those first 2 hours there's preferential. It's really preferred for pre-procedures and staff. So yes, we're doing everything. It's been frustrating for many of you who've seen very long lines when you went for surveillance. So we continue to process and improve that, Jason. So I know we are working on posting the updated information around where to get a test, and I'll take your feedback back to the team. So here's this is private. So there was a social media post from a known COVID patient who came to Bacchus to be seen in the ED and was put in the waiting room, in the common waiting room. So that came to our attention, and we have, in the last really 48 hours, put in new policies and process in place for known COVID patients so we can segregate COVID patients. Recognize Megan Hilliard and Will Gurgis for looking at cleaning the chairs, separating the areas. The patient came knowing she was COVID positive, so we are absolutely segregating and separating COVID positive from COVID unknown or presumed negative patients. So thank you for that question. It's hard to see negative things being said about the organization when I know how hard everybody is working and trying to do the very best. But really, sometimes we find that our process isn't everything it needs to be, so we immediately respond to that. And that's really why we're asking you to give us any feedback you have, because we absolutely do take that seriously. You make us better, right? We always strive to get better every day. Daryl, anything? No? Well, I want to thank you all. It's been...
I'll say, can you hear me?
Yes.
So I think that I want to thank you for your leadership, for the fact that you care about us, and your honesty when it comes to everything that's out there. I think that's always refreshing, and I appreciate that very much.
Oh, well, thank you. Well, I will be honest always. Even when we can do better. So I want to thank you all, and I want to thank you for the questions, and thank you for any feedback you send, and we'll get back in the groove and make this a really good use of your time. It's intended to be value added for all of you, so let us know how we can make it any more valuable. And really, there's not two Donna Handleys. Let me introduce you to Trish Kelly, who's the admin at Bacchus. It says Donna Handley, but you know that we don't look alike, right? So Amanda, thank you, and I want to thank Milrose and Sharon for your support and help today. And all of you, please stay safe. Have a good night.
Thank you.
Thank you.
Thank you.
Thank you.
You're welcome.